Much needed healthcare support on the way for some people in our area who are uninsured or underinsured. Northwell Health will be offering free or discounted medical care to those groups. It follows an agreement with the state attorney general. The goal here will be to limit medical debt collection.
And we say much needed because the results of a brand new Gallup poll show exactly that. High costs kept an estimated 72 million Americans from seeking treatment from needed medical care over the past 3 months.
And on top of that, nearly 39 million Americans said they couldn't afford prescription medications over that same time period. This poll released at the same time as an alarming study showing the effect high costs are also having on our heart health. So let's bring in Dr. Darien Sutton to dig into these numbers. Let's first dig into that study where we're talking about high cost and heart health. This very, very alarming correlation.
Yes.
Let's talk about it and why.
So this is a new study by the American Heart Association. Unfortunately, it reveals some details that we all should be paying attention to. It expects that there's going to be an increase in the rate of cardiovascular disease, heart disease, and heart failure, and also an increase in the rate of stroke. We're talking about significant increases over the next 25 years. 49 million consider, also it's mainly due, again, to these healthcare cost concerns, but when you look at these numbers, it's something that we can also work to prevent. A lot of the factors that go into the reasons why we're seeing these rising rates of health disparities is, number one, people are concerned about the cost of healthcare. 31% concerned about paying for prescription drugs, almost 72 million more concerned about their healthcare costs than any other. And so as we have this looming presidential election, hopefully this will be a main point of discussion.
Yeah, because I mean, those are staggering numbers. 72 million people skip just because it costs too much. What can we do?
You know, I think that there's a couple of things that each person can do to reduce their risk, or excuse me, to reduce their costs. Paying attention to your health insurance, knowing what availability is there for your benefits, knowing what deductibles you can take out, looking to invest in a health savings account, and talking about it. I think a lot of the concern and the frustration leads people away to avoiding it. Unfortunately, that is not the right answer. You need to pay attention to your health insurance and know what benefits are accessible to you.
And with these numbers, have you been noticing more people seeking more so outside medical care, like supplements and things like that?
You know, that's a fantastic question. I think that there's a two-part answer to that. Number one, yes, I do see more and more people looking for other resources other than trusted healthcare professionals to seek out medical assistance. And it's not due to just privilege or it's not due to the curiosity. It's really due to the need. And many people just cannot get an appointment with their primary care office. And also, as an emergency physician, we're seeing more and more patients coming into the ER with questions and complaints that are not necessarily emergencies, but they simply don't have any other opportunity.
This is so sad. I have to say,
really, really concerning.
This is America.
It's really
and
concerning.
People should not be having to decide whether I can go to the doctor, whether I can have a meal. It's incredibly sad. And heart disease, cardiovascular disease, it's just becoming more and more prevalent.
And so unfortunately, it's a sad truth. But again, working on how to reduce those risks is so important.
Truly.
Making sure that you're getting exercise, following your diet. The American Heart Association factors the Mediterranean diet as a really good reduced risk, and also making sure that you're getting enough sleep. You know, these are some basic things that we can all do.
Got to do our part. Doctor, thank you.
Of course.